Hello Synapse Fitness community and welcome to our stretch break video series. In this series and the video you are about to watch, we are going to be doing 3 to 4 stretches for one body area so that you can get the most out of your stretches in a quick amount of time. For each of those stretches, we are going to be holding for about 30 seconds for each side, but I encourage you that if you have the time, you play this video again so that you can get the most out of those stretches. But if not, stay tuned for a very brief stretching routine. Enjoy. All right, welcome. In this video, we are going to be reviewing some stretches for your neck and into the shoulders and chest. This is also an area with Parkinson's that gets very tight for many people, and that is because a lot of times people end up assuming that more flexed position where their shoulders are rounded and their head is down. And with this, these muscles all get really tight around the neck and shoulders and chest. So we're going to go through some quick stretches to help counteract that. So first thing we're going to do are some shoulder rolls. Helps to be sitting up nice and tall and doing as big of rolls as you can. This is hard for a lot of people. Trying to make it as big and exaggerated as possible and go the other direction. Excellent. And then we're going to get right on into our first stretch. And we're going to be sitting up tall, trying to keep those shoulders down. And then I'm going to lean my head over to one side while trying not to lose my headphone. And I'm going to try to keep that shoulder down. That's a big important part of this. A lot of times people just kind of bend to the side while letting that shoulder creep up. And we want to keep that shoulder down. Sometimes people even sit on that hand to keep it down while bringing that head over to the side. And we're getting a nice stretch through the side of the neck there. Now, as we're doing that, you could even explore here a little bit. You could try bringing your head down just a bit while you're still leaning to the side. That changes the stretch a little bit. Or perhaps you want to try looking up a little bit. See what feels like a good stretch to you. Everybody's different with where they're tight. This is really about exploring your own muscles. And let's go over to the other side. Same thing, keeping that shoulder down, perhaps even sitting on that hand if you need to, while you bring the head over. You might find that one side is tighter than the other, completely normal, but just work it as best as you can. And there should not be any pain, all right? You should not be experiencing neck pain as you do any of these stretches, but it should feel like a good stretch, like you're doing something to those muscles. And then from there, see if you can go down maybe a little bit. Again, you can explore with that movement. And maybe looking up. Again, whatever feels good for you and your neck as you do that. Okay, coming back up towards the center. And now we're going to go ahead and bring our chin tucking down to our chest, stretching out the back side of the neck. And you may even, this is one scenario where it will allow you to kind of round through the spine a little bit more, and you might feel even more of a stretch as you do that. Try to really kind of breathe out and relax and let that head drop as far as it is comfortable. Just like the last stretch, from here you can play around a little bit. You can maybe tilt over to the side just a bit while keeping that head down to see if you feel the stretch in a little different area. Maybe go over to the other side. Finding where it feels tight and working to lean into that motion and release. Relax and release. Back to the center. I don't know about you, but the longer I do that, the more I can feel my head and those neck muscles relax. But now we're going to come back up, and now we're going to do the opposite of that motion. We're going to be looking up. Now again, if you have any neck issues, if this brings on any pain, or kind of funny nerve feelings, please do not push into that. Now I'm going to have you look up as far as is comfortable, okay? And for some people, we get really tight through kind of the fascia, which is a layer of connective tissue just under the skin. So I find it helpful, for me, I get a deeper stretch if I kind of pull down, I traction a little bit on the skin on the front of my chest as I look up. I'm also going to try to keep my chin closed, my mouth closed, and my chin up. And that deepens the stretch. Okay, so again, if you don't feel much of a stretch, try pulling down and keeping your mouth closed as you do that. All right, come back to the center. And some people get a little dizzy as they're doing these stretches, so take a moment and see if you need some time before you move on to the next ones. It's kind of normal. Turning the head into these extreme positions can sometimes cause a little bit of funny sensations for people. So make sure you're going at a pace that feels good for you. Now we're going to, again, be sitting up tall, keeping our shoulders down and back with that good posture as we turn the head like we're trying to look over the shoulder. Okay, notice I am not moving through my trunk. Okay, I'm keeping my shoulders exactly in the same spot as I just try to move my head. Okay, this is a great one. If you are driving, this is very important to checking your blind spots. And when you're stretching, you should feel it on the opposite side than you're looking. So I'm looking that way, but I'm feeling the stretch over here on the opposite side of my neck and shoulder. Again, keeping that shoulder dropped down and back really helps. And let's go on to the other side, okay? So going over, keeping that shoulder down and back as I will try to look over my shoulder as best as possible. Now this is a really hard stretch or movement for many people with Parkinson's, and that is because the spine, including the neck, gets very rigid and has a hard time with rotational motions. And that's exactly what we're doing here. We are rotating through the neck. So do your best and back to the center. Okay, the last stretch that we are going to do is a stretch for the kind of shoulder and chest area. So we described that many people have more of this stooped posture or these rounded shoulders, not just with Parkinson's. This is an issue in our culture that's widespread. But we want to take some time to stretch those chest muscles out, those shoulder muscles out. So I'm going to stand for this. You could do this against a wall, at a door frame, anywhere where you can find a little perch for your arm. I'm going to put my forearm up against my bookshelf right here, and I'm going to be rotating my body out like so. Okay, so that I can get a nice stretch going right here through this chest muscle. Helps to loosen that up. Now, if you are somebody, if you have a pacemaker, or if you have had DBS and you have the pack there in your chest muscles, please be cautious with this and only go as far as feels comfortable. It's still okay to stretch, but we just want you to be more cautious with that motion. Don't overdo it. And again, make sure you're turning that body. If you don't feel a stretch, right, we're probably not quite set up as well as we could be, because pretty much everybody can feel a stretch with this. All right, so make sure that you are kind of leaning forward into it, rotating your body away from that arm to get that stretch. Now we can go ahead and do the other side. You could just flip right there. I'm going to come over to the other side so that I'm not away from the camera. Same thing, forearm supported as I lunge forward and rotate my body. Feeling a good stretch through those chest muscles. Excellent. Okay, now remember, you could repeat any of these stretches. You could play this video again to get some more benefit out of these. These are great done when you're having some discomfort, or just great done on a regular basis to prevent issues from popping up. I hope that helps and that you continue to watch more of our Stretch Break series. Thank you.
This video is brought to you by Synapse Fitness Foundation, a nonprofit empowering people with Parkinson's to live their best lives through exercise, education, and connection to others. The presenter of today's video is Dr. Kelly Becker, physical therapist and founder of Synapse Fitness Foundation. If you found today's video useful, please click the like button and forward this video onto somebody that you think would find this useful. Thank you.